I hope you're doing well. In the video, we discuss the care that should be taken after hip replacement. Please like the video to support us. Subscribe to our channel and introduce us to your friends. Diet. Use a high-protein and high-calorie diet to accelerate the healing of soft tissue and bone. To prevent constipation, consume a high-fiber diet, fruits and vegetables that contains bran and ample fluids. Consuming vegetables, citrus fruits, and fresh fruit juices rich in vitamin C can aid in faster wound healing. Avoid consuming substances that promote calcium excretion in urine, such as caffeine-containing products, coffee and soda, alcoholic beverages, and red meat. Activity. Avoid engaging in intense physical exercises. Severe bending of the joint can cause dislocation, so it is necessary to avoid such movements. After surgery, with the permission of the doctor, you can walk with a walker or underarm crutches. However, you will need assistance for daily activities for several weeks, which should be considered in the preoperative planning. Care. Make changes to your living environment to prevent falls. Falling can lead to fractures around the artificial joint, which is much more challenging and problematic to treat than fractures in individuals without an artificial joint. Install grab bars on the bathroom walls to assist with changing positions and prevent slipping. The bathroom chair should be stable and non-slip. Both sides of the stairs should have handrails to use when going up and down. Collect all slippery rugs and loose cables on the floor of the house to reduce the risk of falling. A suitable chair for the patient is a sturdy chair with a firm seating area, not excessively soft, and when sitting on it with the feet on the ground, the knees should not be higher than the hip joint. The chair should have 2 armrests and a sturdy backrest. Always have a slightly firm cushion to place on car seats, sofas, or chairs so that your knees are lower than the level of the hip joint. Chairs, especially the one placed at the dining table, should have a higher base than usual. Do not cross your legs while sitting, as it may cause strain on the hip joint. Always use a raised toilet seat. The height of the toilet seat should be slightly higher than usual so that when sitting on it, the knees are at the level of the hips, not higher. Do not lean forward when sitting on a chair. Do not bend the hip joint while putting on socks, trousers, or shoes. By correctly using antibiotics as prescribed by the doctor and monitoring the surgical site for swelling, firmness, discharge, and promptly informing the doctor of these conditions, you can prevent postoperative infections. Avoid bending forward to pick something up from the ground. The operated leg should not bend inward. Change the dressing of the wound using sterile techniques and by knowledgeable individuals at healthcare centers. Take the prescribed antibiotics at the specified time to prevent infection at the surgical site. Use a bed. Sutures are removed within 1 to 14 days after surgery. Avoid long journeys. It takes a minimum of 3 to 6 months before the doctor allows you to climb stairs. Follow-up visit. Regularly visit the doctor at the specified intervals for continued treatment. Limb shortening, internal or external rotation, severe hip pain, and inability to move the limb may indicate prosthetic dislocation. If any problems occur, promptly consult a doctor. If you notice the following symptoms, consult your treating physician or go to the hospital. Severe pain in the injured limbs that is not relieved by regular painkillers. Tingling, numbness, or coldness in the extremities. Pallor, discoloration, or bruising of the fingers at the end of the limb. Pain and redness at the site of the wound. Thank you for watching this video until the end.